carcinogenic viruses. They produce cancer. We also know radiation can produce cancer. We also know that chronic inflammation can produce cancer. We know that intermittent hypoxia can produce cancer in certain cells. What is the common pathophysiological mechanism by which all this happens?
Cancer rates are alarming. 30 years ago, medical students were told that 1 in 4 people would get cancer in their lifetime. Now it's 1 in 2.
1 out of every 2 men and 1 out of every 3 women will be diagnosed with cancer.
But your diet plays a crucial role in this rise, as highlighted by decades of research. Cancer is also a metabolic disease linked to mitochondrial dysfunction and disrupted metabolic homeostasis. This shifts the focus to how your diet impacts your cancer risk.
One person's breast cancer could come from a carcinogen, another one from an occluded milk duct causing intermittent hypoxia, another one from exposure to radiation, another one from the BRCA gene, another one from just being older.
The Western diet and lifestyle are significant contributors to higher cancer rates, unlike ancestral diets, which correlate with lower cancer prevalence. Research indicates that poor nutrition, high carbohydrate intake, and a sedentary lifestyle create an environment where cancer can thrive.
Having an elevated body mass index or carrying extra weight is directly linked to multiple different kinds of cancer.
The worst food that feeds cancer cells, sugar. Sugar fuels cancer cells like gasoline fuels a fire.
So it's a can of soda that's got 10 tablespoons of added sugar to it to make it really sweet. No human body can tolerate that over any period of time.
Cancer cells thrive on sugar, using it as their primary energy source. When you consume sugar, it breaks down into glucose, which cancer cells rapidly consume to grow and multiply.
Sugar is not a carcinogen. Okay, sugar does not cause cancer.
Research shows that cancer cells heavily rely on glucose and another substance called glutamine. These 2 components are vital for cancer cells' survival and growth. Glucose provides the energy, while glutamine supplies the building blocks for growth. This dual dependency makes high-sugar diets particularly dangerous for your health.
Your human body was designed to eat a low-sugar diet. Yeah, it's true. And if you eat too much sugar, you cause damage to all of the tissues and cells and organs in your body.
High carbohydrate diets, rich in sugar and refined carbs, significantly contribute to cancer growth. Foods like sugary drinks, pastries, and white bread cause your blood sugar levels to spike. This spike leads to increased insulin production, promoting the uptake of glucose by cancer cells. The more sugar and refined carbs you consume, the more fuel cancer cells have to grow. An important point to consider is the link between sugar and glioblastoma, a deadly brain cancer.
You got to go for the cancers that have no hope, and that's glioblastoma. 99% of people are dead within 10 years, 95% within 5 years.
There's been a significant lack of understanding about this connection. As mentioned in the expert quote, sugar has nothing to do with glioblastoma, which speaks to a profound lack of knowledge. This statement underscores the critical need to recognize sugar's role in feeding cancer cells. When you consume sugar in excess, it creates an environment in your body conducive to cancer growth. The constant supply of glucose means that cancer cells have an abundant source of energy, allowing them to proliferate rapidly.
In cancer, there is some defect in the ability of the mitochondria in the cell to produce energy.
This makes managing your sugar intake crucial for anyone looking to reduce their cancer risk. Cutting down on sugar means being mindful of all sources of sugar and refined carbohydrates in your diet. Processed foods, sugary beverages, and even some so-called healthy snacks can contain high levels of sugar. Switching to a diet low in sugar and rich in whole foods can help starve cancer cells of the fuel they need to grow.
There's plenty of foods that have been studied that actually have been shown to be associated with a reduced risk of cancer, whether it's green tea, whether it's soy, whether it's tomatoes.
The relationship between sugar and cancer is clear. When you consume sugar in excess, it provides cancer cells with the fuel they need to grow and multiply.
That these tumors are driven by glucose. So we started lowering the glucose, and we got direct relationship between the lowering the glucose and how slow the tumor would grow.
Understanding this connection is essential for making informed dietary choices. Reducing your sugar intake can be a powerful step in cutting off the energy supply to cancer cells, ultimately helping to prevent and manage cancer. Mechanisms of sugar in cancer growth. Cancer cells use glucose in a unique way that helps them grow and multiply quickly. Unlike normal cells, which rely on oxygen to produce energy, cancer cells primarily use a process called fermentation. This process allows them to convert glucose into energy without needing oxygen, making it an efficient way for cancer cells to thrive even in low oxygen environments.
Basically, all normal cells use oxygen to make energy, and the tumor cells do not use oxygen. So they use large amounts of glucose, and their waste product is not CO2 so much as it is lactic acid.
When you eat foods high in sugar, your blood sugar levels spike, causing your body to produce more insulin. Insulin helps cells absorb glucose from your blood. However, high insulin levels also promote the release of insulin-like growth factors. These growth factors play a significant role in cancer progression by stimulating cancer cells to grow and divide more rapidly. Moreover, high sugar intake leads to systemic inflammation in your body.
Effect of eating sugar, which leads to the release of inflammatory cytokines and leads to pain, joint stiffness, all kinds of diseases in the body.
Chronic inflammation is a known risk factor for cancer. When you consume a lot of sugar, it can trigger inflammatory responses, creating an environment where cancer cells can grow more easily. This inflammation can damage cells and tissues, leading to mutations that may cause cancer. The combination of glucose fermentation, increased insulin and growth factors, and systemic inflammation creates a perfect storm for cancer development. Cancer cells get the energy they need from glucose, while high insulin levels and growth factors further drive their growth. At the same time, chronic inflammation from sugar intake provides an ideal environment for these cells to thrive.
More than 125 million people in the US have some sort of chronic inflammatory disease.
Other foods that feed cancer cells. Refined carbohydrates are one of the major culprits when it comes to feeding cancer cells. Foods like white bread, pastries, and other processed items are high in refined carbs, which quickly break down into glucose in your body. This rapid conversion leads to spikes in blood sugar and insulin levels, creating an environment that supports cancer cell growth. When you consume these foods regularly, you provide a steady supply of glucose, which cancer cells use to fuel their aggressive growth through fermentation. Processed meats like bacon, sausages, and hot dogs are also linked to an increased risk of cancer.
Certain diets will increase cancer. Keto has been shown to increase cancer because it's more meats, and processed meats can certainly increase cancer.
These meats often contain harmful preservatives and chemicals like nitrates and nitrites. During cooking, these chemicals can form carcinogenic compounds. Additionally, processed meats can trigger inflammation in your body, which is another factor that can promote cancer development. Consuming these meats frequently can therefore contribute to a higher risk of developing various types of cancer.
Numerous publications saying that fresh meat is a probable cause of cancer and that processed meat is a convincing cause of cancer,
including colorectal cancer. Trans fats, found in foods containing hydrogenated oils, are another significant risk factor. These unhealthy fats are often present in margarine, fried foods, and many packaged snacks. Trans fats raise your bad cholesterol levels and contribute to systemic inflammation. This inflammation can create a conducive environment for cancer cells to thrive. Studies have shown that a diet high in trans fats is associated with an increased risk of several types of cancer, including breast and prostate cancer.
There's a correlation between trans fats and cancer, but now it seems that what we do know about it is that, in fact, they are simply very inflammatory fats, and inflammation in itself.
Healthy alternatives to avoid feeding cancer cells. Switching to a low-carb or ketogenic diet can be a powerful way to avoid feeding cancer cells. These diets focus on reducing carbohydrate intake, which lowers blood sugar levels and makes it harder for cancer cells to thrive. By limiting carbs, your body starts using fat for energy, producing ketones in the process. This state, known as ketosis, starves cancer cells that rely on glucose for fuel.
And as I said, the two fuels are glucose and glutamine. So the diet drug cocktail is designed to keep the rest of the cells healthy
Incorporating leafy greens into your diet is a great start. Vegetables like spinach, kale, and broccoli are low in carbohydrates and packed with essential nutrients. They provide antioxidants that support your immune system and help fight inflammation. Including healthy fats such as avocados, nuts, and olive oil can further enhance your diet. These fats provide long-lasting energy and help maintain ketosis. Lean proteins are another crucial component. Foods like chicken, fish, and tofu offer high-quality protein without the added unhealthy fats found in processed meats. These proteins are essential for repairing tissues and maintaining muscle mass, especially during cancer treatment.
So the muscles have a capacity that when oxygen becomes deficient from overuse of muscles, the muscle will then use the local glucose to produce massive amounts of quick energy with the waste product of lactic acid.
Therapeutic ketosis is a concept emphasized by experts. It involves maintaining a specific ratio of low glucose and high ketones in the blood, known as the glucose-ketone index.
An index of ketones and glucose for brain cancer patients, glioblastoma and some of the other brain cancers.
Monitoring your GKI can help ensure you're in a metabolic state that makes it difficult for cancer cells to grow.
Cancer is a mitochondrial metabolic disease that can be managed effectively with metabolic therapy.
By following these dietary strategies, you can create an internal environment that supports overall health and minimizes the risk of feeding cancer cells. Assess your diet and make healthier choices to reduce cancer risk. Remember, we have to know the tools that we have, what will work the best, and how to blend the system.
To exercise, and it doesn't have to be blood, sweat, and tears in the gym. It just has to be some sort of movement on a regular basis.
Subscribe, like, and share this video for more insights on health and wellness. Thanks for watching, and see you at the next one.